Welcome to the 5th tutorial of 3dSlicer. This tutorial uses 3dSlicer version 5.6.0 stable release for Windows, but it is also valid for Linux or OS operative systems. The MR Brain Tumor 1 sample data should be loaded. Open slicer scene resulting from previous video tutorial. This chapter is oriented to test more segmentation methods. In previous chapters, we have segmented soft tissues, brain and tumor. Now, to finish with the complete segmentation, we will segment the skull. To initialize, reopen the slicer scene from the last tutorial session. Occlude all data except the original volume named MR Brain Tumor 1. In order to obtain a better visualization of the rigid tissues, use the Adjust Window Level tool placed on the top menu. Place the cursor over one of the 2D views. Hold left button down and move up and down, left and right to change brightness and contrast of the image volumes. Fix the levels to clearly identify rigid tissues. Bones take care to not occlude parts of the rigid tissues. Remember that this is just affecting to visualization and does not alters data. A correct visualization helps to obtain accurate results. Note how, in central slides from sagittal view how. By varying the display parameters, the bone tissue disappears. Select a displaying parameters that shows all bone. Now, let's start with the skull segmentation process. One option to create a segmented volume of the cranium is the use of Threshold tool. Occlude all views unless MR Brain Tumor 1 volume to ease the visualization in the process. If volume rendering ROI are occluding part of the MR Brain Tumor 1, please extend them to show all volume. Then, select Segment Editor. Create a new segmentation and select MR Brain Tumor 1 as source volume. Add a new segment and name it. Select Threshold tool. Test modifying the upper and lower ranges until all cranium is selected. And minimize the rest of the anatomy included into the segmentation. Set the sagittal view to the central slide to ensure that all cranium has been selected. If the lower range is too low, the amount of soft tissue increases. If the lower range is too high, parts of the rigid tissue are not included. This second case is critical because the generated volume will include holds. Holds in the frontal bone should be avoided. This part will be used in the surgical planning. Review the slides to ensure the correctness of threshold selection. Then, click Use for masking. Further segmentation actions will only be applied on the segment mask volume. Now, select Paint tool and move to sagittal view. Use this view to start painting over the desired regions. In this case, paint over the skull. The Paint tool only affects to the mask regions. Painting out of the mask has no effect. The paint action propagates to adjacent slides. The sphere position is represented in all 2D views. And also in 3D view. Activating the visual plane of sagittal view can be useful to understand the current position of painting tool over the anatomical volume. Diameter of the sphere can be modified to speed up the process. But using a sphere diameter too big entails risk of selecting too much non-skull tissue. Painting sphere can be also used in 3D view. Take care because using 3D view can increase the selection of non-desired regions. Once all slides have been correctly painted, show the segmentation in 3D. Occlude the rest of visualization layers to obtain a clear view of the new segmentation volume. As the resulting value shows, during the selection process, some non-desired anatomy have been selected. It is possible to remove small artifacts using the Smooth tool. Set the pre-established kernel size and smoothing method. Apply and study the results. Observe how the smoothing method using 3 mm has generated holes on the upper part of the cranium. Undo the action and decrease the size to 1 mm. Now the smoothing operation has not effect. Set to 2 mm and apply again. Now, multiple non-desired volumes have disappeared. To continue with the refinement process, apply Islands operator. Select Keep Largest Island and set voxel size to 100,000 voxels. Apply and observe how volumetric islands with volume lower than the threshold have disappeared. Finally, apply the Erase tool. A good option is to activate some planes that will help during the navigation. Erase tool uses a sphere of a selectable diameter. All volumes inside the erasing sphere are removed. Use the 2D volumes jointly with the sliding planes to identify non-valid segmented parts. The Erase tool can be used in both 2D and 3D views. The process of using all these tools can be iterated to refine the segmentation volume. For the purposes of this tutorial, it is important to ensure that the frontal part of the cranium is correctly segmented.